As coronavirus continues to spread, people are rushing to buy protective masks, and supply can't keep up with the demand. That is worrying public health agencies.
I do understand why so many people are lining up to get masks, but we also don't want to run out of masks for our healthcare providers, because that will be a really serious problem for our entire healthcare system.
There's no role for these masks in the community. These masks need to be prioritized for healthcare professionals that, as part of their job, are taking care of individuals and/or individuals who have this virus and are in home isolation or home quarantine for those family members.
And wearing them will not necessarily prevent contamination.
If you're the one wearing the mask, you probably are getting a false sense of security.
That's because viruses land on things you touch throughout the day. Railings, seats, doorknobs, money.
But things that we can do to protect ourselves is wash our hands a lot, try not to touch our face, elbow bump instead of shaking hands. But also, don't sit in an environment with poor ventilation with somebody who's sick.
Like cars and cabs.
If you're sitting in a car and it's on recirc, you are rebreathing your breath and that of everybody else in the car.
Milton says this means an infected person should be wearing a mask to keep from releasing the virus into the air in respiratory droplets.
Droplets that flew from your nose or mouth to someone else's.
All of this is why the National Institutes of Health and the Centers for Disease Control say following simple rules can help curb the spread of the virus.
Everyday measures like covering your cough or sneeze, staying home when you're sick, are very important. And of course, the evergreen wash your hands.
So hashtag cover your mouth. And don't forget to
wash your hands and elbow bump and put a surgical mask on the sick person.
Bronwyn Benito, VOA News, Washington.